Welcome back to the Intended Lifestyle. This is your host, Dr. Brian Nymphius. For those of you who don't know who I am the clinic director for Victory Chiropractic and Spinal Decompression in Southlake, Texas. I'm also the author of The Intended Lifestyle, which is a 40-day roadmap to better health. And one of the reasons why I wrote The Intended Lifestyle, it's a 6-week program that I wrote. And the goal was to help people live a healthier life. And what I realized was throughout years of being in private practice is I would tell patients to eat right, to exercise, trying to get them to live a better lifestyle because it helps with their back pain, helps with their neck pain. And so patients would tell me all the time, they say, well, I just forgot to do it today, or I'll do it when I get home. And one of the things that would happen is that I realized that they didn't know how to live a healthy lifestyle. They didn't know that certain foods were bad for them or that what certain foods were doing to their bodies. So I created the Intended Lifestyle to help people learn how to live a better lifestyle. And then I began teaching it. So we teach classes all over the place, and especially we teach them in churches because it's such a Christian-based program. And one of the things that we are doing right now, this is actually week 3 of our Intended Lifestyle class that I'm teaching right now at White's Chapel Church in Southlake, Texas. So if anybody from the White's Chapel Church is listening right now, I just want to say hello and welcome to the show. And I want to remind you that this is a caller-driven show, that if you have any questions, I'd be glad to take them on air. The number you can call is 866-660-5759. Now, we're talking about injury prevention and recovering from injuries today. And what I want you guys to do is realize that you can recover, and there is a way you can recover even faster than you expect. So we talked a little bit about some of the common injuries and common ways people get injured. So now what I want to do is we'll talk a little bit about the care. What do you do once you become injured? What do you do if you happen to hurt yourself? Well, there are a lot of different ways you can treat it conservatively, and I'm a big fan of conservative care because I think that conservative care is one of the most important things that we can do. So let's use the example of a twisted ankle. I brought a twisted ankle up in the last segment, so let's expand upon that. Let's say you've twisted your ankle. Well, maybe you stepped off a curb wrong, maybe you twisted it playing football or basketball. So you have a twisted ankle. And when you have this twisted ankle, you have a certain set of symptoms that are going to occur. Your ankle is going to swell, it's going to become slightly discolored, it's going to be warmer, and it's going to hurt. And that all those things get you to realize you have a twisted ankle. You get it diagnosed, most of the time it's one of 4 levels of a sprain strain. So you either have a grade 1 sprain or a grade 4 sprain. Hopefully you don't have a grade 4 because that's almost a complete tear. And if you have a complete tear, you're going to need some sort of surgery. So that's not going to fall into the category of being able to be treated conservatively. So let's go with a grade 1, 2, or 3 sprain strain of the ankle. Now, there are things you can do. You have over-the-counter medications. You have things like aspirin, Advil, Tylenol, whatever your favorite over-the-counter pain reliever or non-steroid anti-inflammatory drug may be. You can use that. Most personal trainers, most athletic trainers, most physical therapists, and most medical doctors use what is called PRICE. It's called the PRICE method. PRICE is an acronym. It stands for pressure, rest, ice, compression, and elevation. That's what PRICE is. So I have a big problem with using PRICE, and especially when you use that method compared to or along with over-the-counter medications. And here's where I'm coming from. Now I want you guys to understand, I have to warn you that what I'm about to explain to you may fly in the face of everything you've ever known or ever heard about how to correct a sprain strain of the ankle. And luckily for me, I know this works because we see it at the office day after day after day. But I have to warn you, it's probably going to blow your mind, and you may not fully grasp the concept of it right away. And that's okay, because we've all grown up thinking that ice is the greatest thing since sliced bread when it comes to injury rehab. So let's get back to the twisted ankle. It's swollen, it's discolored, it's warmer, and it hurts, and it's absolutely positively immobile right now. Trying to move it hurts. Now when you twist your ankle, what you've done is you have real quickly, instantly traumatized the area. You've caused joints to stop moving. Joints, have accidentally injured themselves. The muscles have a degree of tear to them. So when you use pressure, what you're doing is you're trying to remove the inflammation. The same thing with the rest. You're trying to stay off of it. So you put pressure on it, which is some sort of a bandage. Then you ice it, and then you compress it so that it squeezes the inflammation up towards the heart. Sounds like a good idea because you're trying to remove the inflammation. And this is what everybody did for me when I was in school. This is what everybody I see do on the sidelines. And let me tell you where this goes wrong. It goes wrong right out of the gate because the inflammation happens for a reason. Nothing in the body is done by accident. So if you have an inflammation from twisted ankle, you want that inflammation there because that inflammation is bringing the healing to the injured area. You see, your body doesn't do anything by accident. So you're all of a sudden going to flood the injured area with all kinds of, on a cellular level, all kinds of different white blood cells to help remove some of the injured area and then begin healing the tissue. Because you don't want to develop scar tissue. That's one of the major problems of any kind of injury is the development of scar tissue, and then that scar tissue is weaker. So you compress it, and you use ice, and you're trying to squeeze that inflammation out from underneath the injured area. Well, right away, if you're compressing the area, you're squeezing the inflammation, and the inflammation is there on purpose. Then what you do is you use ice. The ice is going to numb it up so you don't feel the pain anymore. Again, sounds good in theory, but the reality of it is if you apply ice to an injured area, what you do is you effectively shut off the brain's ability to communicate with the injured area. And if the brain doesn't know what the injured area wants, then the injured area is not going to get what it needs, so the body isn't going to heal as quickly. And what you end up doing is getting the inflammation out of there, decreasing the pain, and prolonging the injury, and prolonging the rehab afterwards. Then the next thing you do, you compress it, you elevate it, and all the while the body is never being allowed to heal like it was designed to. Now, some of you may be thinking, well, if you don't put ice on it and you don't wrap it, what are you supposed to do with it? And that's a very fair question. And here's what you do. You've injured the area, you want it moving as quickly as possible. So you have to make sure that the joints are fully mobile. You have to restore some lost motion. Because anytime you injure an ankle, you twist it real quickly, there's a set of things that are going to happen to the bones of the foot and the bones of the ankle. And right away, they're not going to be moving. The inflammation is going to prevent even more motion. And even though it's painful, you have to get in there and restore motion. You have to get in there and allow the muscles to line up and work like they should. So there's the lower leg, you have the tibia and the fibula. And most people forget about the fibula. The fibula is that bone on the very outside where you can tap on your ankle. It's usually somewhat tender if you were to bump it. Well, a lot of times that fibula, if you trace it all the way up to where it comes in contact close to the knee, that fibula needs to be adjusted as well. So you need to restore some motion there. Everything in the body revolves around properly moving joints, especially if you've been injured. So this is where I come in. This is where I do things a little bit differently. I don't like to use over-the-counter medications like aspirin, Tylenol, Advil for one major reason. Studies have proven that long-term use of aspirin inhibits your body's ability to produce glucosamine. If you inhibit the body's ability to produce glucosamine, you inhibit the body's ability to naturally allow for smooth-moving joints. Now, and while you may be also decreasing the pain levels, what you're also doing long term is you're thinning out the blood because they're blood thinners. That's how you get to feel better. As you thin out the blood, you slow down the body's ability to send the proper white blood cells to the injured area so that your body can heal itself. So again, if you're using ice, you're numbing the area up so your brain can't tell the body what to do. Then you're compressing it, you're squeezing what healing powers are already there, you're squeezing that out. There's nothing left for your body to use to heal the injured area. Then you come in there and you compound the problem by adding over-the-counter aspirin or Tylenol to it. And it doesn't have to be over-the-counter. You could have a prescription for painkillers, and what you're doing is you're then completely shutting off the body's physiological ability to heal itself. All the while, the problem gets worse and worse and worse, and that's why we see so many people that are chronically injuring their ankles, chronically injuring their back, chronically injuring their shoulders, because they continue to shut off the body's ability to heal itself. Our bodies are perfectly designed to heal from an injury. What we have to do is let our bodies do what they were designed to. We have to make sure that our bodies are moving properly so that our joints can heal, so that our muscles can heal. Because if the joints aren't moving, then there's very little chance the muscles can contract and relax on a normal and natural basis. And if the muscles don't contract and relax, the rehab that you do for an injured area is going to take longer, and it's not going to be as effective, and your muscles aren't going to become as strong. So if you can restore the normal joint motion, the joint heals faster, the muscles heal faster, the inflammation goes away on its own, and the body heals faster. You recover that